There's a quiet secret more than half of all women over 50 are living with. Not from strangers, not even from the people who could help them most, their own doctors. If you're watching this, there's a good chance you already know exactly what I'm talking about. You may have never said it out loud, but you've probably planned your day around it. Picture a woman who quietly stopped going to her Tuesday exercise class. Not because her knees hurt, not because she was too tired, but because she never knew when a laugh, a sneeze, or one unexpected jump might leave her embarrassed. Little by little, without realizing it, she began organizing her life around one simple question. Where's the nearest bathroom? She's never told her sister, never told her closest friend. Maybe she hasn't even told her doctor. Instead, she convinced herself this was just part of getting older. And that's exactly what I want to change today. Because if any of this feels familiar, I want you to hear something before we go any further. You are not alone. And this is not something you simply have to accept. By the end of this video, you'll understand why bladder leakage happens, what actually makes it worse, and the simple changes that help most women regain confidence. Here's something that surprises almost everyone. More than 6 in 10 adult women experience bladder leakage at some point in their lives. After 50, it becomes even more common. Yet most women never mention it to their doctor. Not because it isn't a medical condition, but because somewhere along the way, it became something people felt embarrassed to talk about, instead of something they deserved help for. And before we go any further, there's one mistake almost everyone makes with Kegel exercises. It's the reason many women spend months doing them faithfully and never notice real improvement. Almost nobody explains it. I'll show you exactly what that mistake is in just a few minutes. But first, let me quickly introduce myself. I'm Dr. William Mercer. For years, I've been reviewing research on pelvic health and healthy aging, then translating that science into practical advice that's actually useful in everyday life. I'm not here to sell you a product or a program. I'm here to give you clear, honest, evidence-based information, without judgment. Let's begin. Let's clear up the biggest myth right away, because it changes how you'll hear everything else in this video. Myth: bladder leakage is just something you accept as you get older, the way you accept gray hair. Fact: it's common, but the medical community is clear. It is not a normal, unavoidable part of aging. It has identifiable causes, and those causes have real, often very effective treatments. Common and normal are not the same thing. That distinction matters more than almost anything else I'll tell you today. So why does this happen in the first place? There are 2 main types worth knowing. Stress incontinence, leakage triggered by physical pressure, like coughing, sneezing, laughing, or exercise. And urge incontinence, a sudden, strong need to go, sometimes with little warning. Many women experience a mix of both, common enough to have its own name: mixed incontinence. Here's what's physically happening, and this is where things get interesting. Think of your pelvic floor as a hammock of muscles, holding up your bladder, uterus, and bowel from below. Childbirth, aging, chronic coughing, extra weight, all of it can gradually stretch that hammock, the same way a hammock sags a little more year after year under regular use. A looser hammock supports less securely. That's exactly what allows small amounts of leakage to slip through under pressure. There's a second piece to this, especially after menopause: estrogen. Estrogen keeps the tissue in your urethra and vaginal wall thick, elastic, and well supported. Think of a rubber band that stays supple with regular use versus one left in a drawer that turns brittle over time. As estrogen drops after menopause, that tissue can thin and lose some of its natural seal. That's a major reason bladder control issues often show up more in this stage of life, even in women who never had trouble before. A few other factors add to this picture too: prior vaginal childbirth, chronic coughing from asthma or allergies, and health conditions like diabetes, which can affect the nerve signals between your bladder and brain over time. None of this means something is permanently broken. These are simply pieces of the same puzzle, and every piece we understand is one more thing we can actually work with. Hold on to 2 ideas: a weakened support hammock and thinning, less elastic tissue. They explain almost everything we're about to cover. I think of a woman I'll call Diane, a composite of patients I've encountered many times. Early 60s, otherwise perfectly healthy. She started keeping a cardigan tied around her waist at every family gathering. Not for warmth, just in case. She assumed something was uniquely wrong with her, something she'd somehow let happen. It wasn't a personal failing. It was a hammock that had been quietly stretching for decades, completely unrelated to anything she'd done or hadn't done. Have you ever assumed a symptom like this was somehow your fault, rather than simply biology doing what biology does over time? Let's start with the tool most women have heard of, but very few were ever taught to do correctly. This is exactly the mistake I promised you earlier. Kegel exercises strengthen exactly the muscles we just talked about, your pelvic floor hammock. Done consistently, done correctly, they're remarkably effective. In fact, a 2024 review of pelvic floor exercise research found that more than 9 in 10 postmenopausal women who stuck with a structured program saw meaningful improvement. Here's how to find the right muscles. Imagine trying to stop the flow of urine midstream. Or imagine gently trying to hold back gas. That squeezing, lifting sensation, that's your pelvic floor. One important note, that's just for identifying the muscles. Don't make a habit of actually stopping your urine stream regularly. It can interfere with your bladder's normal emptying over time. Once you've found the right muscles, here's the actual exercise. Squeeze and lift for 3 to 5 seconds. Fully relax for the same amount of time. Work up to 10 repetitions, 3 times a day. Full relaxation matters just as much as the squeeze itself. A muscle that never fully releases can't contract as effectively when you actually need it to. Now, here's the mistake I promised you. When most women are told to do a Kegel, they unconsciously squeeze their thighs, glutes, or stomach instead. Why? Because unlike a bicep, there's no mirror, no visual feedback for these particular muscles. If Kegels just didn't work for you before, this is very often exactly why. Here's a simple way to check. Place a hand gently on your stomach while you squeeze. If your stomach tightens along with everything else, you're likely engaging the wrong muscles. It may be worth one session with a pelvic floor physical therapist just to get proper feedback. I think of a woman I'll call Carol. She'd done what she called Kegels faithfully for years, several times a day, with 0 improvement. One session with a pelvic floor therapist revealed the truth. She'd been perfectly, consistently squeezing her glutes the entire time. Within weeks of correcting her technique, she noticed a real difference, for the first time in years. One more thing worth knowing. This isn't an overnight fix, and that's completely normal. Muscle takes time to respond, typically 6 to 12 weeks of consistent practice before most women notice a meaningful change. If you try this for a week and feel discouraged, that's not a sign it isn't working. It's simply too early to tell. Here's the takeaway. It's not just whether you're doing Kegels, it's whether you're doing them with the right muscles, fully relaxing between each one, and staying consistent long enough for the tissue to actually respond. Exercises matter, but they're only part of the picture. What you do the rest of your day matters just as much, and this next part surprises almost everyone. Let's walk through a few changes that genuinely move the needle. First, bladder training. Go to the bathroom on a schedule, say every 2 to 3 hours, rather than the moment you feel the slightest urge. Gradually stretch that interval a little longer every week or 2. It sounds almost too simple, but it retrains your bladder's sense of urgency over time, the same way you'd gradually build up distance in a walking routine, rather than attempting to hold distance on day 1. Next, and this is the surprising part, pay attention to what you're drinking. The goal isn't to drink less water. Restricting fluids often makes urine more concentrated, which can actually irritate the bladder further. The real target is bladder irritants, caffeine, alcohol, carbonated drinks. Cutting back on those specifically, not fluids in general, tends to make a real difference. Weight matters too. Extra weight adds ongoing pressure directly on the pelvic floor, like leaning on that hammock every single day. Even a modest reduction in weight has been shown to meaningfully ease symptoms for many women. Constipation is one people rarely connect to this at all, but straining regularly puts real strain on the same support structures. Treating constipation through fiber, hydration, and movement often improves bladder symptoms as a side benefit. And if you smoke, here's one more genuine reason to consider quitting. Chronic coughing repeatedly stresses the pelvic floor. Same as repeatedly jumping on that hammock accelerates the sag. There's one more everyday habit worth mentioning: how you lift and move. Holding your breath and bearing down while lifting something heavy, a grandchild, a bag of soil, a piece of furniture, puts sudden, forceful pressure directly downward on the pelvic floor. Exhaling as you lift, instead of holding your breath, meaningfully reduces that pressure. A small adjustment, it costs nothing, but it adds up over thousands of repetitions across a lifetime. Quick myth to clear up here, because it stops a lot of women from even starting: the idea that surgery is the only real fix. Fact, the majority of women see significant improvement through non-surgical approaches first, the exact ones we're covering right now. Surgery, when it's genuinely needed, is typically considered only after these have been given a real chance. Let's pause and gather what we've covered. Kegels, done with the right muscles and real consistency, retrain the support structure itself. Bladder training retrains urgency. Watching bladder irritants, managing weight, treating constipation, addressing chronic coughing, all of it reduces the ongoing pressure on that same system. Remember Diane tying that cardigan around her waist at every family gathering? None of this would have required her to feel broken. It would have simply required her to know where to start. Now you do too. So when does it make sense to bring in a specialist? Here's an honest answer. If you've given lifestyle changes and consistent, correctly done Kegels a genuine few months and you're still not seeing meaningful improvement, that's absolutely worth a conversation with your doctor. I want to be clear, this is not a last resort. It's not a sign that something has failed. A referral to a urogynecologist or a pelvic floor physical therapist is an extremely common, well-established next step. For many women, it's actually the fastest path to real improvement, not a slower one. If that first appointment feels intimidating, here's what it typically looks like. A conversation about your symptoms and history. Sometimes a simple internal exam to assess muscle strength and coordination. A personalized plan, maybe guided pelvic floor training, bladder retraining support, or for some women, additional options like a pessary or topical estrogen therapy. This is a specialty that exists specifically because this is common. You won't be the first appointment of the day covering exactly this, and you won't be the last. There are also a few signs that deserve a phone call sooner rather than later. Blood in your urine, pain or burning when you urinate, a sudden and significant change in your symptoms, real difficulty emptying your bladder, or fever paired with back pain, which can suggest a kidney infection. None of this is meant to alarm you. Most causes of these symptoms are very treatable, but they do deserve a prompt conversation with your doctor, rather than a wait-and-see approach. Here's what I want you to leave with. Bladder leakage after 50 or 60 is extremely common. You heard the numbers earlier. But common was never the same thing as something you simply have to live with. It usually comes down to a weakened support structure and changing tissue, both of which respond to consistent, correctly done Kegels, a handful of specific lifestyle adjustments, and, when needed, real professional support that exists specifically for this. None of that requires shame. All of it responds to attention. Before you go, picture one specific woman in your life. Maybe it's your mother, who's quietly stopped doing the exercise class she used to love. Maybe it's a friend who always seems to know exactly where the bathroom is before anyone else does. Maybe it's you. If someone came to mind, send them this video today. Not because it's an easy thing to bring up, because it might be the thing that finally makes it easier. Sometimes the most caring thing you can do for someone is hand them permission to stop being quiet about something that was never something to be quiet about. Before you go, have you ever tried Kegel exercises before? Just a quick yes or no in the comments. I read every single one. One last thing, and I say this at the end of every video. Everything you just heard is for educational purposes. It's not a diagnosis, and it's not a substitute for a conversation with your own doctor, who knows your history far better than any video ever could, and who has almost certainly had this exact conversation many times before, even if it doesn't feel that way from where you're sitting. If you're noticing any of the warning signs we discussed, please don't wait to bring them up. My goal with this channel will always be the same. Real research translated into something you can actually use, without the shame this particular topic so often carries. Remember the woman from the beginning of this video, quietly skipping her Tuesday class? She didn't need a dramatic fix. She needed someone to tell her this wasn't a personal failing, that real answers existed, and that she never had to carry it alone in the first place. Now, you know all three of those things too. You don't have to plan your life around a bathroom map anymore. You don't have to carry this quietly, the way so many women have for so long. One consistent change, done the right way, is often where real relief begins. Take care of yourself, and I'll see you in the next one, this time without a secret to carry.
Dr. William Mercer.